If I'm hypertensive, what are some of the things that I should specifically do to protect my heart?
Okay, so as a hypertensive, I encourage my patients to limit salt in the diet. So it's a low salt diet. And be aware that salt is hidden in tin foods. And a lot of times if we purchase food from outside, it has a high salt content. So that would be the first step. Also exercising, as I mentioned, 150 minutes per week of moderate intensity exercise. And compliance with the medication. So there is a major issue here in Antigua in terms of compliance with the medication. One of the stated reasons being side effects. But what I want to encourage our citizens is to, if you do have side effects, see your physician, have a discussion with them. Probably the dose might not be appropriate for you. There are other options that can be started. But leaving the hypertension without treatment can lead to a stroke, enlargement of the heart and heart failure, also kidney failure. So don't leave it unmanaged. Please seek follow-up with your physician, and there are other options that can be started.